stay CEO Obobia Dako Opoku yewia na yahwe President Mahama na katua o promise ye ene some appointees bia asobrache ode asotwe komo om se omobosumi akatua bosom makomakom yensa ma yemfa ma wom yemfa nkoto sa fotuo nim na yemfa nkosa nkrofo yade no yenhwe a vice president to we say ewia na that conversation no ashas here.
This to our trust fund, popularly known as MahamaCares, as part of our journey towards the universal health coverage, where we want to get to a point where, irrespective of your status in society, irrespective of your location or your ability to pay, you must have access to quality health care. And so the policies this government is rolling out complement each other. Now, there are two major policies. One is a free primary health care. The free primary health care, we assessed and realized that about 80% of our health needs is primary health care. And therefore, His Excellency directed that every Ghanaian, all the 33 million people must have access to primary health care. Now, the game changer is prevention and early detection of diseases. So free primary health care, you don't need any money to access it. All the 33 million people will access it. If you go beyond the free primary health care or the primary health care, which ends at the polyclinics, whether the district hospital, the regional hospital, and the teaching hospital, National Health Insurance is there to save you. Now, that are not captured by the National Health Insurance. Then MahamaCares comes in to also assist patients with those, conditions.
Your Excellency, on the 1st of August last year, I received my appointment as the administrator for the fund. I'm happy to announce that all the teaching hospitals has been connected to our software. By next week, we will be done with the regional hospitals. And then we know that they can start onboarding the patients. I also want to tell you about the catheterization labs that are being spread across the country. For now, in collaboration with the Ministry of Health, we are working on 3. One for Kolebu. Kolebu, we are just decommissioning and replacing because they already have, but they caught fire. But then for Komfuanochi and Tamale Teaching Hospital, we started from the scratch. And for these facilities, when you enter, it's a one-stop shop because they are hybrid theaters, there's a pharmacy, there are consulting rooms, there are ICUs, oxygen plants, and everything. So as a patient, when you enter, you have everything at your disposal, including a pharmacy. So by the time you get out, you're ready to go home.
The stories need not stay with us. The stories must be shared. Whatever you are doing, which is so beautiful, should be shared. Let the public know what you're doing. I also noticed that you have already practiced the affirmative action because I can see in terms of your percentage that you're all doing well. Illness can't be prevented, but sometimes regardless, the body itself also chooses its own path, and that nobody really decides to be ill, but sometimes these things happen. So when people are in that kind of difficulty, they need support. We need somebody to care. And generally in our culture, we care a lot. We know families that have lost wealth because one person has been challenged. But it gets to a point where the government must step in. And that's exactly what MahamaCares is doing. So I want to commend all of you for coming on board and for playing your roles and playing them so well. I'm not surprised that there's a woman leading this and there are many women here. You all know that somehow you become a caregiver, whether you decide so or not. So again, I can never stop commending all of you. And all of us pledge that we will continue sharing the story even further.
Okay, so Vice President Professor J. Nano Pokuajaman, no. Sansana Health Minister Kwabena Mita Kando Tenenka, and I so Administrator Edema MahamaCares, Ghana Medical Trust Fund, Honorable Obobia Dako Opoku, and no. Government officials, especially the appointees, including the President, are committed 6.1 million Ghana cedis into the fund. Gordon, I'm sure for you.
Before me call into the Ghana Medical Trust Fund issues, just this afternoon, the General Secretary of the NDC, Honorable Fifi Fiavikwete, issue a statement on the ongoing internal election processes and dues payment. Into on the Facebook page, we're posting officially, and we're stating the categorical say the means of payment no pay. Who use any other means edit your dues and reflect it. The first one a short code star 920 star 25 hash star 920 star 25 hash. Now we follow processes no edit your dues. 2 www.ndc.org.gh/dues. I repeat that one, www.ndc.org.gh/dues. Now, ode etua. So these are the two means party no edi egu o say obi bia opese okojina ewo branch level, constituency level, and all the other levels no be use edia dues and verify it yourself. Memo being verifying now because nipa no verify no catch will say I reflect it. Now later ye be verification ye hwe na and reflect ya. Untimi nka se obi na hwe ma me ene de wan kasa ogegirije. At the end they will disqualify you and you end up making unnecessary noise thinking say party no na abo buga nso no obi ambo buga ye mama ye ni enda ho na ye nya ejuma ne se de se SFA because enche ye koto aba executives and this is the process, so let's follow through as expected. On MahamaCare issue, mefa we fi di kese we so na me de abo His Excellency John Dramani Mahama Abaso ye to aba ma o se mampeni a we expect say even though we be continue dia ewo ho dada no, you need to equally think outside the box. Inti proud to 2024 elections, part of your manifesto promise was to establish the MahamaCare or the Ghana Medical Trust Fund, aka MahamaCare. A lot of Ghanaians were in doubt, say, is possible? Say, you bet me I establish it, and I say, yeah, establish it. We may be say, MahamaCare, no, ne buta pa anything. In Pempi, no boache, ya yari bi a friend chronic. Yari ane kun eye ya, na eye very expensive. Anameboa.
Yeah.
Yari ane kun eye ya, na eye very expensive. Just imagine say, oh, kidney problem. Not every day and not 3 days. As I say, we call no we call you that the simple this kidney dialysis. Near the to dialysis so. Just imagine say we bushia nibi. Where will you get money to pay? And no more say any de kika ho and a MahamaCare no about be take care of. And watching most of these chronic diseases, National Health Insurance doesn't cover.
Yeah.
The free medical, free primary health care doesn't cover. Because free primary health care, is more of preventive. Because PAMPI, ye Germany pano, yarinu epie ni hunemu, and sana wako for ayareshe. So sometimes ebedu sam pempen so no na additority dada. And a nane kunso ayeden akoye cannabis. So the free primary health care no the frequent testing and assessment of the citizens. Said ya bibi wo wa ye be bo kokwa. yabo kokontem bibi wo ayese yeso ano a yaso ano entem na ambeye bibi bia ano beye den nti anu nso no and take care of this chronic diseases. Nti haven't explained briefly the free primary health care there ne botai pa and the existing national health insurance should tell you say the Ghana Medical Trust Fund no is very very important. Yes, ye twa kwan na se anka wo fia wo se kwan na tene da ye betwa na ebe kan wo de na obehu se kwan no sa na entene de abaka ni na ne se asanka mo de fa hanso anke be yie nti enne na maybe unue bi wo papa wo maame enkoto sa yare no emuye, so you don't see the need and the expenses that goes into fighting most of these chronic diseases. So
before I become say I do chum in a car mun na here no.
Yeah, education minister. Yeah. So because ubi bia finding who in that circumstance no, you may not see the importance of the MahamaCare. Maintina ha mom pai say because o doubting tinu we busu ni bi enye bi. Minti mi mbo yare emma obi. But twin be obi a unfortunately of finding who and any bibi ever into those chronic circumstances no, and you listen to the person's story. Now obe who say the Ghana Medical Trust Fund has come in timely, better late than never. Because anka yenya way 20 years ago anka maybe a bi anhwere omadofonum anka bi anhwere omoma anka bi anhwere omo papa no manhwere omo maame nom nanso no ade bia wo ne mmere. And I feel say nyankopon wo kwan a ofaso de ye ne niema bebre. This is the time the Lord has opened way for such a brilliant policy from the NDC led by His Excellency John Dramani Mahama. Wachi John Mahama ye osie adea oyo. Oye president a ontunto suo ento femunsan fa na no nyeden emfa biom. Oka se obeya obeye. And this is the president we have. Onu ankasa yesi leadership by example. So we papa now you cannot advise your children on that very character uda ne di ofie. Enti miribia no yeko school no there is this common parent yeka say leadership by that example. Enti officially or launch Ghana Medical Trust Fund ewie no openly okasa onu ankasa as mampeni to set the ball rolling. No be who say onu ankasa wo gidie wade na ode aba ne mu no oso onu ordinary 6 months salary anameboa 6 months salary oyimu simpoa enyimu teku. The controller and accountant general and transfer all those funds in support of the Ghana Medical Trust Fund. Ghana yewo emrebia ye friend asset declaration. Say we an appointee of any government. As I say, we declare asset. Asset simply means enyama wo ansa na obabeye sa adwuma no. Ayede ahye wonsa se biye. Na se ufi abenwa ne sonso a wasan declare wo asset. Na ya juxtapose niema na wo ansa na ubem ena dia wa kwai aka ho emra ufiri mu na ya hwe weda niema wa kwai foforo no eno waketua ebo ebra anase embo ebra ena yemra yo hye say we appointee bia you must declare your asset. But as human as we are, a delay in the process of declaring their assets. And John Mahama, who is an abiding citizen and president, who doesn't want any of his appointees to act in violation of the law, decided to obey punishment. And this was the punishment. Obi biya went to me and declare assets at the time scheduler or the mayor. you have to forgo 3 months of your salary. And also you can't hear the naysayers doubted it, say, and yet possible. And now me no say an official statement from the government spokesperson referencing an authority, an independent body, controller and accountant general. And for the past 24 hours, controller and accountant general has not said otherwise. Say Enyam pass 6.1 million out of this John Dramani Mahama 6 month salary. And some from the appointees omugo contrary no, has been transferred into the account of the Ghana Medical Trust Fund. That this is the first tranche, so you're aware.
Yeah.
And yet the full accumulation of the money. Another one will also go. Where in the full we need to make us You see, John Mahama has a track record in virtually adibia all year. In the first term, some bekaya or share the appointees ni na say they should donate 10% of their salary into building infrastructure in our health sector. 8-9 years after, Onwankasa donate on 6 months salary to support same health development in this country.
Okay, mame mo we ni kakra. According to communique, Honorable Felix Kwacho Fosude Baye, no.
Okay.
With regards to 6.1 million, now you can have some. Say now can say controller after sa info ne buy and controller MBD bank here.
Yeah, sure.
Say no cry na say
sure.
Okay, so the statement paragraph 3 says that the controller and accountant general has formally notified government that he has deducted and transferred a total of 6.1 million to the fund pursuant to the president's directive.
Yes.
We're not just a controller, no?
Yes.
And now,
I notify government.
Say, a bona share Sikano.
Matete.
My transfer 6.1 million. Aqua to fund in him.
The reason why
Musikana ma Mobona share no nam dia kwakotua.
The reason why me di controller bear money say
yes.
Normally say government appointees ekasa. People sometimes cast doubt on it.
That's true.
You get the point. It is a Felix natural officially. Our reference controller and accountant general.
Controller mumna.
Then my reason why I raise controller is that senya no kwaria.
Yeah.
Say controller I make those deductions. And Konusu say no.
I get you.
It is not true that we have done any such deduction. But for over 24 hours, there is no contrary. And even in Felix statements, and I can you know. And ya buying na eka.
Yeah.
Controller mom natural come buying say directives na mama indeed. Ya deduction up to a tune of this.
Yeah.
Ama ya diakwa den. Ya diakwa. So nobody can doubt this. Say they are not making first. No? This similar thing happened in 2016.
Okay, to conclude the statement, you know.
Okay.
Sikanen sayo.
Yeah. Say they make
defaulters yenen ka ho.
Yeah.
Or say no. Controller say or make arrangements to transfer the final tranche, which will cover the asset declaration defaulters.
Yes. So okay. Make say
okay, first part and second part.
Make both.
Yeah.
And make say 6.1 has gone.
Yeah.
Which is not the entire money as I say.
That's true. I heard you.
Into second tranche so it is even more than that.
Yes.
You get the point. Into watching when you the first time at NDC are buying, are exhibiting the commitment to improve our health delivery services, both infrastructure, equipment, and what have you. 2016, all government appointees were deducted 10% of their salaries for cheap compound construction. John Mahama is the only government, I stand to be corrected, but I think I am right on this. Before Befia in 4 years, now we're constructing over, I think, 2,000 cheap compounds. Over 2,000 cheap compounds across the length and breadth of this country. And part of it, that appointees 10% salary supporter, they call into the health infrastructure development. 9 years after, the same president has come ene obema a very fine and brilliant policy to take care of diseases are taking a lot of lives. Kidney failures, heart diseases, very expensive to fight such diseases or sicknesses. And now abuying through the Ghana Medical Trust Fund, abuying for all the costs associated with it. And watching, you see, one novel thing, say, the Ghana Medical Trust Fund has not left the process of equipping our facilities with the needed facilities that is required. Bear in mind, Sabanka se mi woska mi di betua u treatment amount. Now ko facility ho. I mean the hospital. Na equipment a ye hia say ye de hwew. Na wo ton ni eni ho a. What would the government be paying for? Anameboa. He won't pay for anything because ukwa ye hwew na ye tuaka. It is a dialysis machine eni wa ye do beto so a. Government will not pay anything. So another thing a Ghana Medical Trust Fund say part of sike ko ho nyina no omo identify hospitals are omo lack some essential medical equipment. Because I follow through the administrator Honorable Obobia has visited Okonfanochi Hospital Anameboa. We visited Kolebu, we visited Rich, we visited all the important and critical health facilities in this country. And baby obekobiano omo man update of enema omo here things they lack. Now we're making sure say he will provide them for them. Because I am making provisions to equip the health facilities, it ceases to be a health facility. As an ambulance, it's supposed to be equipped with some health facilities. Uremu, and we cannot give you first aid in it. It is an ordinary car. Anameboa. It's an ordinary car. It is a omwamboa mayan equipping the hospitals with the needed facilities, health equipment are here. The MahamaCare cannot function properly because it is hinged on quality delivery of health care. So that the day-to-day you lose citizens unnecessarily. We be catch you say me yare miti me call hospital. Obekwa the within a short minute we better say we free because the quality is not there. So it is not like Abayano I enroll the policy just like that. Making fanfare, administrator keeps moving, traveling and taking salaries. But what together with the Ministry of Health and other private health providers, to equip your hospitals with facilities and equipment so that at least we can advance in health delivery. What is share? Nancy, young guy, 29 years old, Charles Emisa. And the report he presented 2 days ago.
Yeah.
If you read the report, or when you follow when the report was being presented to the minister, commentary Honorable Mr. Bedu Akosa was given a heartbreaking. Because that guy shouldn't have lost his life. Yeah, the Wako Police Hospital. Yeah, the Nako Rage. Yeah, the Nako Kolebu. Simply because of system failures. And Nuntinu, Obi engineer, a young engineer, lost his life. Last week, you let you know who work as well. Okowo, Owari, the very man to who ye marks the 1 year Owari. Yes, last year. 1 year on, our warrior or Kowa, Wakutu Niwu.
It's a crown crow.
Yes, am I yet body Nunia Colano on Yem, the Noko 2 mortuary. until the following day because na mochirman demanded for 1,000 cedis and sana we yi abofra no ewo maami ni yem. And because the father couldn't provide the money, akwala ni ye jan wo maami ni yem till the next day papa ne ko pay ska baye. Why are we doing this to ourselves? You get the point? To end with it,
yes.
Watch it. This is a very solid, brilliant policy. A government that has thought beyond normalcy. Government that are doing outside the box. Abaya ya doing the health care of our citizens. Abaya yesusu say, if productivity will go high, health care must be critically taken care of. Because if the workers are sick, production will go down. So this Ghana Medical Trust Fund, abase ebeboa the existing health policies are war, like the NHIS. This is the government that thinks about the people. The Ghana Medical Trust Fund, abase ebeboa, together with the free primary health care. Yeni na yen get involved.
Okay.
Because yare enima abofra. Yare enim openyi. Yare enim NDC. Yare enim MPP. Yare enim apostolic ni na enim Pentecost ni. Yare enim Roman Catholic ni enim Methodist ni. Yare enim obi oye juma o gold board. Anas obi oye juma o to. Yare di eba oye ni freni. Baby obenya kwan no enura. So let us all come together to support this noble call.
All right. Thank you so much. Me can for Girl Super SP for no amount say a ope premium quality. A bema correct choice. Ibra auto fango bia dia gu aye washing moa. Be it aye car moto. And I said bia de fango gu mono. Se wada a Girl Super SP. And ye can for the amount. A boa ema unji no jina so che. A boa ema unji ne sound no kwati misampa. We use oil, but Oko use Girl Super XP oil no dear. Mr. Wada. Papa Tikana Shenson. Was so feel ya ube feel it. You can't go la. No, I just say good energy. Palm Hills, natural mineral water, for so down my can be boy in Sansona SIC. Say any factories outdoor esodia. Yen the bomb hobain. Numaku outdoor. Woman so est chassis so moon. And I'm off a far. A yen ya shebwa amom dache no so etimi gina ma pomia abusuan so se gina ye na ade ehia wo modo musika ko shem na o invest ya me so sad da so no yen ne bema no abamu kama over 60 years ni SIC insurance ababe Ghana bambo built on integrity, reliability and face care. What you say say also from far to motor, accident to travel, marine and more. Me pacho SIC insurance. Entiano brokers nending komo 0800 100 055. Etikane shen and sumami PC Herbal Center for Swadar Makambi. Yet the Jumadi at 12 PC say about menstrual pains, poor flow, waist pains, back pains, male vitality, poor vision infections, outdoing nano, or the called prostate. Yes, man at age 40 starting na o prostate no a peshe na kofa how amro dachi. Ope babia aswe bakwa about prostate or moye hua de papa PC Herbal Center eso eka ho. Entiano so no your Medina social welfare and Atakra the Air Force Station Basic School 0540 740 740. Omadama can be any Rijumadi so air 12 Chachas, Mamitio.
Watch it. Namifa Quanyari, Namincha Obium, Namincha or tea for Nina, Namincha producer Sebiga, Namincha Mama, me co panelist. Nameno Crinere Ghana home. John Dramani Mama, Nyami Winshrano. John Dramani Mama, Nyankopon, on to Nunquam. So we should be our dream in my home, or done in my and a John Dramani Mama. John Mama can say, a mambu we are all saying Bamuno, Wambasa Ebi or Baby rich. Wambasa or Baby Pisca, to say, and another Dunko Kufado Case.